Hello and welcome to this week's Catchup. Today we're going to talk about the supportive circle.
Stop. Right. Okay, we have a technical problem. It seems that Tracer's video, it got corrupted on transfer. So you'll hear a voice because the microphones are connected to my phone. But you won't see her. So I'm going to be a bit creative. And, enjoy the video. The information's still there. It's just, you only see me.
The annual general meeting at St George's NHS Trust.
South West London.
Oh, for goodness sake, South West London St George's NHS Trust.
See you there. So earlier this week, I went to the Sutton Dance community where they host the Sutton Mental Health Foundation's supportive group. And this group is for parents of autistic children. See the video here. This is Jane. I've come up to, I'll let Jane tell you about what she does here.
So we're at Sutton Community Dance, and we run a group called Supportive Circle, which is for parents and carers of children and adults with autism and ADHD, some undiagnosed, and some with similar issues. And we just talk about kind of the problems we're having with schools and with everyday life and with work, finding work for adult children and things like that, and whatever's on people's minds really, and about how it all affects our mental health, how we can support ourselves, support each other, that kind of thing.
So can anyone just walk in off the street, or do they have to book? Or
we had a lady who she came to get her eyebrows done at a place nearby, and she got talked into coming along, so anyone can come. Some people are people who've been to Sutton Mental Health Foundation before for other reasons,
right?
Or they know about it because they know about Sutton Mental Health Foundation and they've seen it on our website. But it could be anywhere. It could be anyone can just walk in. Especially now that we're here at Sutton Community Dance, sometimes people just walk past and see it advertised. And
Fantastic. Okay, thank you very much. So,
hi.
And when we spoke about it before, you said you wish you knew about that group.
Yeah, I wish I did know about these groups when my children were younger, because I had no support whatsoever, not even from family. There you go. Quite a common place though, isn't it?
Yeah. And earlier this week, Wednesday, I attended the, I've forgotten what it is now, South West London St George's Mental Health Trust's annual public meeting.
You forgot what that was, yet you're drilling it into me.
I've actually got it written in front of me.
That's cheating.
So what it involved was service and innovations in patient care. The Trust is focused on creating an immersive experience for parents utilising technology like virtual reality headsets for therapy and expanding outreach programs. I can't read. I really can't read.
I do believe it's just started to rain.
They highlighted, we're working from the van today, the office. This is where I do all my meetings. They're doing outreach programs for therapy. They highlighted the efforts to the care and least restrictive settings possible, reducing hospital stays and support patients in their own communities. There is a specific focus on children's services, neurodiversity, and improving access to care.
What financial and operational performance? The finance officer reported on the Trust's strong financial position, including a surplus and significant savings. He emphasised that the majority of the budget is spent on staff, staff and clinical care, and highlighted achievements such as paying invoices on time and meeting capital expenditure targets. Wow. If you're not asleep already, you will be soon.
Well, the workforce and culture. They discussed focusing on creating a great place to work to retain staff, which I think is a good thing. Efforts include anti-racism, flourishing membership program for Black and Asian staff, and a high-attended mental health conference to foster collaboration. Yep.
Addressing health.
Would you like to hold it?
I can't read that word because I'm on distance glasses and I can't read it. Addressing health inequalities. A significant portion of the meeting was dedicated to the Trust's new health inequalities strategy, GGG. They acknowledged existing disparities. Is that how you pronounce that? Disparities?
Yeah.
Particularly for Black and ethnic minority communities, and shared data on progress in areas like reducing seclusion and physical restraints. Oh my God. The plan includes a focus on improving access to services and addressing racial disparities in outcomes. Now, when they say seclusion and physical restraints, that's not on staff, is it?
No.
Imagine that. Get paid for doing stuff like that, Go to Amsterdam, you get it good price. Anyhow.
I guess this is where I come in. The co-production and community involvement. They repeatedly stress the importance of co-production, which is members of staff, members of the public who have had experience in care or in these mental health conditions and issues. They're actively involving patients and caregivers in the design and delivery of services. An example of that is the support group I run on a Wednesday night. I know the camera's gone. We got a camera outside. You would have seen, maybe you would have
put it on there.
Well, I wanted a view from outside of the office. Anyway, I'm trying to. So I co-host a support group for carers in the evenings on Wednesdays for people who live in the 5 boroughs, South West London, 5 boroughs. Examples include the development of dialogue care plans, a new family and care network, Hold the Hope project. The Hold the Hope project is a support group or a support system for people who are considering suicide or have attempted suicide. It's a really good group. If I can find it, I will give you a link to their website. I think they've got a website, but they've certainly got a music video. Again, I'll see if I can find it and give you a link to that. If not, I know the person who wrote it. I'll get in contact with them and see what I can do. Hold the Hope project, which uses voices of people with lived experience of suicide to train others. Yeah. There was an answers and questions and answers session. I can't talk. My mouth's gone all funny. The meeting featured dedicated questions and answers with patients and carers who asked about specific issues and discharge care, employment support, and long waiting lists for children's services. which were all answered by the trust leaders, the chairperson, CEO. What I will say, that's all the notes I've got. There was, during the questions and answers, there was this one person who was clearly in distress. She described how much she's tried getting help over several years, and the trust turned around and said, "Oh, talk to the person behind you. He's one of the senior people." And her response was, "I already have. He told me to phone 111's option 2." And our experience, don't take this for granted. I'm not saying this is how it is throughout the UK, but our local 111 option 2, the reports I've had are very bad. They don't appear to be helping.
It's good to have somebody in the audience that can challenge the reports that are supposed to be this, that, and good, this, that, and the other, and they're doing so much things, this, that, and the other. And when you get somebody saying, "Well, hang on a minute, no, it's not," I think it's good that they get challenged, because it's proof that it's not happening.
That's another meeting I attended this week, the Triangle of Care. The Triangle of Care community group I attend. The person who runs it is now being taken on by Carers UK. So that group is now part of Carers UK and it's just a formal group rather than a gathering of people in different trusts. Several NHS trusts throughout the UK join, and they discuss such as Dialogue Plus and ways of how they approach carers and how they should approach carers and what they should be doing, and the methods they should be using. So that was good. For the guy who runs it to be recognised and approached to join Carers Plus and have it a formal group, that's fantastic news. So that's all taking place. There are still some trusts around the UK who aren't a member of Carers, of the Triangle of Care, but most trusts are. So there's a common collaboration of how to approach and how to empower carers and what rights they have and what rights they've assumed by becoming a carer. The main problem is you ask someone and they'll turn around and say, "Oh, no, I'm not a carer, I'm a parent, or I'm a partner, or I'm brother or sister, I'm not a carer." But all these people are actually carers. They're seen as a carer by the law because they look after someone. Right. Have you got anything else you want to say?
Good Thursday, good art session. We had Orchard Hill down this week.
Orchard Hill College.
And good crumbs. We had about 15 odd people. It was actually really nice to work with special needs children, or young adults as it were. Again, they were really engaging, and we did a lot of painting together. Yeah, it was good. It was good fun. It was nice to do it again.
And they're coming next week, aren't they? They said they'll be back next week.
Next week, I'm hoping to bring in some jewellery. So if you'd like to come along, you can make some jewellery. But we do actually ask for a donation on this one, because the jewellery costs quite a bit for the accessories, like the beads and stuff like that. They do cost money. So a donation. Yes, we're on about donations again. But that's the only reason why we carry on, is through donations.
We have actually joined the Giving Lottery. So there's a jackpot of £25,000. You can win £25,000. But every ticket which is sold, we get 40p from that ticket donated to our business. So good. That all goes towards take part. It goes towards keeping the posters going. I've just had another order for 16 posters. So it's growing. the network of posters is growing. It's really good.
I think I heard thunder.
No, you didn't. It's not thunder.
I think I heard thunder. I don't like thunder.
Right. So that's the Sweets Catchup. Art on Thursday as usual. Hopefully I will get in contact with the Care Centre this week and do a piece on them. I'm talking to, again, Sutton Mental Health Foundation to do a video on the Talking Hearing Voices group they run. Hopefully I may get another video for the OCD group they run. Yeah. Next month, the last Sunday next month, they're starting the Sunday service from, I think it's 11 till 4. So you get food at a reasonable price, and it's a social event. You can go there if you got nowhere else to be. So yeah, that's gonna be good. Yeah, you happy? You ecstatic?
Always happy.
Fantastic.
Always ecstatic. Can't you tell? Well, that's static, isn't it?
That's static. Not ecstatic. See you next week.